Good morning, everyone. Thank you for being here again. Thank you for helping us spread the message. Like I said, the efforts undertaken over the past 2 weeks to limit the spread of COVID-19 in the community of Fort Liard have been another shining example of our collective efforts to protect residents. In the early days of the containment order, our healthcare and pandemic service response in the community was reflective of our government's priority to act swiftly to the possibility of an outbreak in a smaller community. The rapid response team was deployed to complete testing and contact tracing. Regular communication was established with local leadership to ensure that they were able to support the needs of their residents. A comprehensive communications campaign was rolled out to ensure residents were kept informed and updated with the most current information. With English and South Slavey speakers, we went door to door to check in on residents and provide information and answer questions they may have about the containment order. A vaccination clinic proceeded as planned and a very good turnout from the community. Municipal and Community Affairs worked with the Hamlet to arrange for every household in Fort Liard to have a $250 voucher at each grocery store in the community and established a pickup and drop-off service alongside curbside pickup to make sure residents had access to food and necessities during the order. Our efforts played an integral part of the limited number of cases in the community, but it was the local leadership and residents who played the biggest part in protecting their community. I want to thank everyone in Fort Liard for all they did to follow the orders and working with our team on the ground. The situation could have been a lot worse than it was, and it's because of our collective efforts that we have the results we do today. So thank you, everyone. Our vaccination rollout to date has allowed us to vaccinate over 12,000 residents with the first 2 doses required and have begun to administer second doses. The response has been overwhelming, and I want to thank everyone who has made their appointments and gotten their vaccination. Both Minister Green and I received our first vaccination last week as part of the priority groups, and I'm thankful for the healthcare providers who are making sure that residents are informed and understand the importance of getting the vaccine. This is an important part of our efforts of moving forward. Like the rest of Canada, we are seeing a reduction in the number of doses that we're getting. While this is not ideal, I'm confident that the federal government will work to ensure we get the doses we need to meet our goal of vaccinating 75% of the eligible adult population in the NWT. As I've said many times, while the vaccination plan is progressing as planned, we all need to continue to do our part and follow the public health orders. Wear a mask, wash our hands, and keep a safe distance. Even if you have had your first dose of the vaccine, we're not done yet, but we're almost there. I'd like now to turn it over to Minister Green for some brief comments. Thank you again for helping spread the message.
Thank you, Premier Cochrane. Good morning, everyone. I'd like to begin by addressing the announcement that the federal government made on Friday about the temporary delay in Moderna shipments to Canada. As a result, the NWT is expecting a reduced shipment of the Moderna vaccine this week with 4,700 doses rather than 7,200 doses, which is what we had anticipated. We've been informed that the shipment scheduled for the 3rd week of February will be reduced as well, and we're still waiting for exact details on that from the federal government. Since the beginning of our vaccine rollout, we knew that the allotment and delivery of doses are both out of our control. Our team has built a flexible vaccine delivery schedule to account for shipment delays, weather, and other unforeseen challenges. I want to reassure residents that we have a plan in place to fully utilize our vaccine supply over the coming weeks. We're waiting for the arrival of the 3rd shipment and an update about the 4th shipment of vaccine before we adjust our plan going forward. It's worth noting that the federal government has remained strong in its promise to deliver 75%, enough vaccine to vaccinate 75% of the NWT's eligible population over 18 by the end of March. We remain committed to keeping the public informed through weekly media briefings such as this, as well as communications channels online, on the radio, and in person. We began delivering second doses of the vaccine to our most vulnerable residents and staff in long-term care facilities last week, starting with Avens and Yellowknife and the Jimmy Erasmus Seniors Home in Gahcho. Long-term care facilities in Fort Simpson, Fort Smith, Inuvik, Hay River, and Norman Wells are next in line for second doses, along with the extended care unit at Stanton Territorial Hospital. Residents can check the vaccine schedule at www.ntHSSA.ca/COVID-vaccine or just Google NTHSSA vaccine schedule for the most up-to-date information. It's important to remember that the public health measures and surveillance system that have protected NWT residents from COVID-19 so far are still in place and working extremely well. We will continue to use every possible tool to protect this territory from COVID-19, including public health orders, wastewater testing, point-of-care testing, and vaccine delivery. Since December 31st, 2020, we have delivered 12,241 first doses by visiting all 33 communities. We have fully vaccinated 125 residents against COVID-19 in the NWT. I want to thank local healthcare staff, vaccine teams, and communities once again for making this ambitious rollout so successful. The number of first and second dose vaccine doses given will continue to be updated weekly on the government's COVID-19 website, which is www.gov.nt.ca/COVID-19. in line with our Public Health Agency of Canada reporting, which means the vaccine doses are updated weekly on Monday. I will now hand it over to Chief Public Health Officer Dr. Kandola to provide a COVID-19 update. Thank you.
Thank you, Minister. I will begin with an update of the current state of COVID-19 in the Territory. Northwest Territories has 5 active cases of COVID-19. 3 are connected to the limited outbreak at the Gahcho Kué Winter Road site. 1 is an out-of-territory worker at the Gahcho Kué mine site itself. All contacts are isolated. All patients are doing well. No risks to communities have been identified as a result of these cases, and worksite risks have been contained. We are cautiously optimistic that well-executed exposure control plans on site, alongside strong testing and tracing efforts, have controlled the outbreak at the Winter Road site. 1 additional case was confirmed in Fort Liard yesterday. This diagnosis is not connected to the resolved cluster in this community. It is a work-related exposure linked to out-of-territory travel. Public Health and the Fort Liard Health Center reached out to the individual and their contacts to provide advice on isolation and monitoring. In contrast to the previous cluster of COVID-19 infections in Fort Liard, our present assessment does not identify a high risk of further transmission in the community. We will continue to investigate and monitor the situation. Our wastewater surveillance shows no anomalies in the communities in which we have wastewater surveillance. These communities are Yellowknife, Hay River, Fort Simpson, Fort Smith, and Inuvik. We offer our gratitude to the Public Health Agency of Canada for their continued guidance and generous in-kind testing of our samples. Indigenous Service Canada's We thank them for the funding which helped us get the program off the ground, to our colleagues across departments who continue to coordinate efforts on the ground, and to municipalities for their partnership. We believe that this program, along with rapid testing, enhanced PCR testing capacity, and targeted screening, provides our territory with strong, effective epidemiological surveillance. It gives us the information we need to move quickly. That information, alongside Fort Liard's dedication, allowed us to contain the COVID-19 cluster in the community quickly. To recap on how effective our measures have been, our efforts to address the outbreak cluster began when Hay River received a wastewater signal. An advisory was sent out urging people to get tested who were in Hay River at any point during the self-isolation period from January 1 to 6. An individual had traveled back to Fort Liard after their isolation period, then responded to this advisory and got tested. From there, the health authorities deployed a rapid response team, and through contact tracing, we isolated dozens of people quickly, put a containment order in place, identified 5 additional COVID-19 infections, and minimized the risk of any transmission beyond the travel-related cluster. These surveillance efforts will help keep us all safer as vaccine rollout continues and as we support each other in this pandemic. I want to address the announcements on the delay of Moderna vaccine to Canada and what that means for us. This is a national effort, and we are team players. That means accepting some reduced shipment alongside our colleagues across our country. We are not alone in this effort. As Minister Green mentioned, we are expecting 4,700 doses this week, and we do not yet know the impact on future shipments. This reduced shipment will cause some changes on our rollout plan in the short term. I want to confirm that vaccination clinics already scheduled for this week will not be affected. All right. Due to high COVID-19 importation risks in southern provinces, NWT residents working at remote camps, including mine sites, will begin receiving first doses this week. Existing supply will be dedicated to second doses for residents and staff at long-term care facilities. Once we get a better idea of future shipments from the federal government, we will re-examine our vaccination rollout strategy. Information changes quickly, and we need to adjust our schedule and priorities as more vaccines become available and further information is provided. So we are continuing to work with our federal government to get more information from Moderna as soon as possible, and we will update you when we know more. While this is disappointing, we all need to expect some bumps in the road. This is one of the most complex, all-encompassing vaccination drives in the country. Supply was always going to be strained, particularly until additional vaccine candidates reach market. But as Northerners, we also need to remember just how fortunate we are to have received the allocations we have so far. We will still receive enough to vaccinate 75% of our adult population in a relative short period of time, and much sooner than jurisdictions in Canada. So I want to assure Northerners that as vaccines roll out, we are closely following developments surrounding new variants originating in South Africa, the UK, and Brazil. Apologies. We have not yet detected any of these variants in the Northwest Territories, and we have the tools to aggressively contact trace and isolate potential exposures to stop these variants from gaining traction in our territory. And we are keenly following research to see how the Moderna vaccine interacts with these variants of concern. We are ready to pivot if it becomes necessary to keep our residents safe. And I will end by reminding everyone that sticking to the healthy habits we know work to stop COVID-19 is as important now as it has ever been. So, number one, keep up self-isolation whenever required. Stay home when you're sick and get tested for COVID-19 at the first sign of symptoms. Keep physical distance of at least 6 feet between yourself and others. Wear your mask when you're out. Keep crowds small and spaces large. Wash your hands frequently. Cough or sneeze into a tissue or flexed elbow. And we are incredibly fortunate that so many in our territory have taken these steps over the last year. It is because of that care and attention that we are in a good position today. So let's keep it up, and above all, be kind and support each other as we work to bring immunity to our communities. Thank you.
Thank you, Dr. Kandola. We will now open the floor to questions. Reminder to media in the room, in addition to our three speakers, Premier Cochrane, Minister Green, and Dr. Kandola, Dr. Pegg is also here to answer any questions that you may have. We're going to have all media come over here to this mic to ask your questions, and the one question, one follow-up format will follow. So we'll get started today with Mario from Radio Canada.
Hi there, my question's probably for Dr. Kandola. You know,
So what we know right now is that we have a reduced third shipment, and we don't have any further information on the fourth shipment and the fifth shipment that is mid-March. So we're waiting. The federal government is talking to Moderna, and we're waiting to hear back from them about the fourth and fifth shipments. And depending on what we hear, we may have to readjust our vaccine rollout.
but still with what we have right now, with the doses that we've received, and the amount of people that we gave the first dose to, and I know you don't have these numbers, so we're still waiting for it, but how confident are you that, you know, we will be able to vaccinate at that time frame, of that 6 weeks from whenever the first doses were given to everyone in the communities?
That information, I can't provide the answer because I don't know about the fourth and fifth shipment, but I will provide an update once we know. We do know we're getting a third shipment. And so the vaccines we have on hand, we do have assessment about that. What we do know is that we have provided second doses to long-term care facilities, and that's rolling out this week in all the staff. We still need to, given the situation in the mine and the work campsites, our priority is to provide first doses to unvaccinated rotational workers. So that's our largest priority. We also have to understand that in the UK and Quebec, they decided to go with a 12-week time frame. The data from their approach will be arriving between when the first and second dose is required, and so that may inform us as well. But the main priority right now is to get the first doses in those rotational workers.
Luke, CKLB.
So I got a question on the vaccine rollout and New York. I don't have a lot of details, but I've heard there was an issue with the vaccine administration. I'm wondering if someone can confirm there was an issue there and provide any details on it.
Okay.
I mean, without also having the details of what you mean by an issue, the rollout of the vaccination campaign territory-wide was to target priority populations first. And so those were people living in long-term care facilities, older individuals, people with chronic health conditions that put them at higher risk for severe disease, and people living in remote communities where there would be a significant impact in the event of an outbreak. And that strategy is territory-wide. It targeted those priority groups in each community, and the plan for the vaccine rollout involved evaluation of doses left at the end of one campaign in one area in order to inform the number of doses that were available for the campaign in the second area. And the idea was always to maximize the number of people falling into those priority groups that we were able to vaccinate through the first rollout of the campaign. So what I can say is that we're continuing to target those priority groups with the doses that we have, and that priority groups in Inuvik were also included in the rollout, just as they were in some of the other bigger communities, such as Yellowknife, where not everyone was able to receive vaccine, but priority groups were targeted first.
So is there an issue with non-priority groups getting the vaccine first in Inuvik?
Not as far as I'm aware, no priority groups were initially targeted.
So, according to the online COVID dashboard, 125 second doses have been given. Where have they been given so far?
Thanks. So we have started with second dose at Avens, long-term care facility here in Yellowknife, in the Jimmy Erasmus Seniors Home in Gahcho Kué. Staff for those facilities as well, and we have ongoing second dose rollout in the other long-term care facilities in the Northwest Territories for both residents and staff.
And then, so, for example, like in Gahcho Kué, for example, I know that the vaccine campaign a couple weeks ago, not everyone was vaccinated who was scheduled to be vaccinated. So when the team goes back there for the second round, I guess what I'm asking is, when they go back for the second doses, will it be in the same order they went for the first doses?
What we're doing right now is reevaluating the vaccine rollout based on the dynamic supply that we have, based on the priority groups that have been vaccinated and that remain to be vaccinated, and on the evolving science related to vaccine intervals. So those are things that we are adapting as the situation changes.
The question might be for Dr. Pegg or Kandola. Do you plan to vaccinate a lot of new people, like give first doses, since there's shortage right now? So are you just going to fulfill the second dose and wait to see if you can provide first doses?
So the vaccine supply, as you've heard, remains dynamic. And so what we are doing right now is looking at the vaccine that we have, the supply that we know that we're going to get, and how best to use that to make sure that the highest number of people who are in priority are able to be vaccinated. Dr. Kandola has mentioned the priority to vaccinate rotational workers because they still represent a significant concern for introduction of COVID into the community. And so what we're looking at now are priority groups that remain to be vaccinated and how best to use the supply that we have and that we will be receiving.
Yeah, last week when I asked Kandola if you were afraid that the shipment will be reduced, and basically you said no because the Northwest Territories are a priority population in Canada. So can you tell me more about that? Why was it reduced? Was it
So this third shipment allocation was reduced across Canada, and that has less to do with NWT than Moderna is the company, and with the federal government, they can only promise a certain amount of doses for the third shipment, and that third shipment needs to be distributed across Canada. So we received 4,700 doses, and we're really grateful for the third shipment. And we will work with that to try to prioritize completing our priority populations and then working on our second doses. But we still need to hear more about the fourth and fifth shipment, and that's going to, once we hear that information about when that's, where that is, and that's at a federal government Moderna negotiations, it will help realign our vaccination strategy. The most important thing is that NWT is still much more advantaged when you compare it to the rest of Canada. We have the highest coverage rate. We have rolled out an incredible amount of vaccines in a short period of time. And we need to be strategic with our doses. We still have to prioritize the priority populations yet incomplete, which so the rotational workers and people working in those situations, high risk exposure, they need to be vaccinated and get their first dose. But we also have, there's still people remaining priority population at risk of people who have chronic disease, who are a high risk of severity. That population still, there's quite a significant number waiting for their first dose. And what we're also waiting for is more information. Information involves around the evidence around deferral of the second dose based on the UK and Quebec experience. So all this information will arrive in the next few weeks, and we'll update you when we get the information, but that will definitely inform our vaccination strategy.
We have a question from CBC, and we're going to give this one to Minister Green. With your relationship with the federal government, have you been given any sort of timeline for when we may have any more information about the fourth or fifth shipments of the Moderna vaccine, or is what Dr. Kandola said essentially all we know at this point?
Yeah, what Dr. Kandola said is all we know at this point. It's important to know that we are dependent on the federal government to procure the vaccine from Moderna, and the federal government is dependent on Moderna to produce it. So we're at the end of that assembly line, and so what we can do is adjust our plan to the number of doses, but we don't have any say over how many doses we're getting. Thank you.
A follow-up to that, and I believe we'll get Dr. Pegg to answer this question. At a news conference today, the Prime Minister has approved the deal to produce vaccinations in country instead of importing from elsewhere. Could this affect our NUT's vaccination plan, and do you have any information on that that you could share with us?
So we don't have a lot of information about that, but yes, there was an announcement that the federal government is hoping to be able to produce vaccine within Canada. The vaccine proposed for that is Novavax, which is a different vaccine platform than both the Moderna and Pfizer vaccines. Novavax has submitted a request for approval for its vaccine to Health Canada within the last several days. There has not been a decision made by Health Canada, but certainly it's encouraging to think that there may be a possibility for domestic vaccine production in our future.
Kevin, True North, we'll get you one round.
Do we know exactly when the Gahcho Kué workers and other rotational workers are going to specifically get their vaccine doses?
So we've been working with the mines, and because they have rotation, so some people are on site who are unvaccinated, and some people are available in town. And so we're trying to cover the both rotational shifts, so that allows people to access their vaccines when they come out from camp and before they go to camp. The good news is, aside from Yellowknife, every other community were able to roll out their vaccines to priority populations, of which rotational workers were included. So specifically, we're looking at people who are maybe mainly from Yellowknife, who were now being provided the opportunity to get the vaccine because they're largely unvaccinated. And then for people from the other communities who would have missed their vaccine because they were at the mines at that time. But we're putting out an appeal to all the rotational workers. You work in closed camps, you work 2 to 4 weeks, and you're working with people coming straight from other provinces where there are a large number of outbreaks. You may be healthy, you may not consider yourself at risk, but please consider getting vaccinated because we don't want the virus to come home to the communities and people who are at risk for severity end up being hospitalized. So make an appeal to all rotational mine workers in NWT to contact cpho@gov.nt.ca and get vaccinated. Thank you very much.
My question is in regards to the most recent travel-related case in Fort Liard. Fort Liard isn't one of the designated isolation hubs. I'm curious if this person was given an exception to isolate in Fort Liard, or they were an essential worker, or they didn't self-isolate after returning to the territory.
So we'll have Premier Cochrane take that answer.
Thank you. So at this moment, what we do know is it wasn't related to the other case. It was work-related, that's been shared, but we're still continuing the investigation into the case itself. What I do need to say to people is it's really critical to everyone in the Northwest Territories. If you travel outside the territory for any reason, make sure that if you're an essential worker, that you do the self-monitoring. If you are traveling for other reasons and you don't have an essential worker, do the isolation plan. Wash your hands, wear your mask, keep your social distancing is our best defense. And as Dr. Kandola said, every single person that hits a priority group, please go in and get vaccinated. It's not mandatory, but it is the best line of defense that we have for the most vulnerable in our communities.
Okay, and one final thing for maybe Premier Cochrane, a message of reassurance. Got some viewers online watching, just a message of reassurance for them that the NWT, we're doing what we can. So I don't know if you've got a message you'd like to share.
Absolutely. I want to share that the Northwest Territories has been, it's not luck. We've been very fortunate that not only have we had a very competent Chief Public Health Officer and medical staff throughout, that our businesses, our NGOs, everyone, every resident has stepped up to protect us. We're still the best in Canada, but it's not a guarantee. We're not out of this yet. We're really close to the end, but please, we're very close. Just keep abiding by the orders for a little bit longer, and hopefully this pandemic will see the end and we'll be able to get back to a normal life. But I do want to thank every single one of us and the media itself. Every person in the NWT has played a role in where we are today, and I am exceptionally proud of every person here. Thank you.
Thank you, Premier Cochrane. So we'll close the media briefing off there for today. As a reminder to media, any follow-up questions, please email presssecretary@gov.nt.ca. And of course, for residents at home or those of you here with us that are seeking more information, the GNT COVID website is your best source of information for accurate, up-to-date